Laser season is officially on, and so are our pros. In this episode, I'm teaming up with Alexxa, our cosmetic consultant here at Charlotte Skin & Laser, as we demystify lasers and what each device does, who's a candidate, and how to plan a safe, event-ready glow. We're going to cover rejuvenation to scar revision in this episode. I hope you can join us. Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin & Laser.
And I'm Dr. Emily McLean, a board-certified medical dermatologist at Charlotte Skin & Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life.
Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here.
Because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy.
Let's get started. So I'm joined with Alexxa today, our cosmetic consultant. She helps me explain to everybody what we're going to do with our laser and treatment plan. And today's topic is laser and trying to explain why we use all these lasers. It's in our name, Charlotte Skin & Laser. It has been my career. It's defined my career. After a dermatology residency, I completed a laser and cosmetic surgery fellowship in San Diego from some laser experts. Everything has changed, the whole dynamics, but throughout my 25-plus year career, I've been heavily involved in lasers. So I'm thrilled to talk to you today a little bit about lasers. So we'll start with laser 101, just to try to help give it some science, and approachable science, something you can take and understand. So we'll start with what a laser is. It's a specific beam of light, very concentrated, one beam of light. So the light spectrum goes from low wavelength numbers up to very high wavelength numbers. In that spectrum, there are specific wavelengths that have been harnessed, and we can use them to produce a specific wavelength energy within a device. So that's specifically what a laser is. And by the way, it's not sunlight. That's a whole different wavelength. So sometimes people come in and they go, oh gosh, I'm on doxycycline. I can't have a laser. Yes, you can, because it's not sunlight. Now, they do advise that you use sunblock for going outside if you're on a sun-sensitive medicine or if you have lupus or a condition that makes you sun-sensitive. So lasers are a little bit different. So how does this compare with other devices we use, and what other devices do we use? A lot, right, Alexxa?
So many.
So many.
And I think that's what helps us stand out. We have so many options for patients.
But you know what options do? They make people confused, really confused. Including staff sometimes. It just is a lot to take in, but you can really get a curated approach here at Charlotte Skin & Laser, and I'm always thinking about ways to simplify it, but it's not that simple. Why not? Well, we have lasers, we have radio frequency, there's ultrasound. We don't use it here, but that's out there. Then there's that confusing term, intense pulse light, IPL. It's a favorite. It's old technology, but gosh, it's so good. And so I kind of correct people sometimes. It's not a laser. It's broadband light. On that spectrum I was talking about, from low wavelengths up to very high, long wavelengths, the IPL is just a big flash lamp, big bright light. And it uses these cutoff filters, say at 440 and then at 1100. And in between, there's a lot of different wavelengths, and some of them get red and some get brown. Then within the lasers, there's some things called ablative and non-ablative, a lot of different devices. But let's talk about, in a laser, some 3 key words. And we use them. One of them is wavelength. I've already used it, right?
Right.
Because it comes up in consultation. Well, that wavelength laser is really good for pigment, and that wavelength laser is good for redness. So wavelength is that specific number that the laser has, 755, 532, 1064, 595, a lot of them, right?
A lot. And in the consultation, Dr. Rostan throws out numbers of these wavelengths, and the patient will
Just
look at me and say, what does that number mean?
But she will decipher it. And that's why I'm happy to kind of talk about it here, so at least you know wavelength is critical in our decision making. The other thing that's critical is pulse duration. Okay, so some lasers have a really long pulse duration, and they're good for blood vessels and good for pigment in hair because they're large targets. And some have really, really short, tiny pulse durations. They're good for tattoo removal. They blow apart tattoo pigment, and we can also use them for rejuvenation. Pulse duration becomes really important in avoiding things like bruising and helping us treat patients with darker skin types. So it's important to me, the pulse duration, and to my laser staff. But we may talk about in the consultation because I'm saying, well, we need a long pulse duration laser for this, but this one's a really short pulse duration, just great for rejuvenation, no downtime. So you'll hear pulse duration getting batted about. And the last one is cooling, how we cool the skin so the laser energy can penetrate. So that's a little scientific, but these things do come up in the consultation. And even as I treat patients, we treat a lot of different veins on the face, including like big ones under the eye. And some people want me to treat large ones in other areas. And I'll say to them, well, we can try it. This one looks a little dangerous. And the danger is I need a really long pulse duration to heat this big target, really big target. Well, it's like a heated pipe. If you've got a really big pipe, it can almost heat your room, right? Like a radiator. Right. We don't live in the north, but up north they have these pipes in their roof that heating coils, and it melts the snow. So if I heat up a really big target with my laser, we gotta be very careful because that heat will spread, just like spreading into your room like a radiator, spreading into the snow to melt the snow, and that can cause a problem. So if we decide to treat, I'll tell you, look, during treatment, I'm going to put an ice pack right on it because we want to control that cooling. So cooling comes up. And I think those are the big ones. And then there's that other word I use, which really doesn't have to do with the laser, but how it works is the ablative and non-ablative. And folks, I've tried. I can't come up with a better word. They're literally, ablative means it actually makes little microscopic holes in the skin. They're open, which sounds gross, right? But I can't think of a better way to say it. So you'll leave the office a little oozy.
Very oozy.
Yeah, and you'll ooze just a little bit through these little microscopic holes for about 48 hours, and there is more downtime associated with these. And then we use this thing non-ablative, which feels like no downtime, and they're all called no downtime when they're non-ablative. But we define social downtime that you might have with it. So ablative versus non-ablative. We try to make it understanding for you. Automatic with that, and you're probably already making this conclusion. When I say ablative, you're thinking more aggressive. And technically, yes, but more aggressive does not always equal best results. So,
why would you choose more aggressive?
Yeah, that's a good question, Alexxa. Why would we reach for more aggressive? We do it for certain types of acne scars. I do it for surgery and burn scars. The microscopic ablative laser has been shown to release the tension in a scar, and then for deeper wrinkles and deeper sun damage. That's where we reach for the ablative. There's another trick with ablative. It can actually reduce your risk of skin cancer. So sometimes we choose that.
Yeah.
Yeah. I think a question that I know you get a lot, and I'm sure we get it a lot here too. What's the difference between all these different devices?
And why are you choosing this device?
Well, one difference has to do with target. We've already talked about target a little bit. So sun damage often has red, right?
Right.
Ruddiness, red, brown spots or pigmentation, and then wrinkles and texture changes on the surface. So different target. So I might reach for one that selects or targets brown spots specifically. But then your red, so we might do a redness laser. And then there's texture changes. We choose one that goes deeper into the skin. Its target is water. Radio frequency works a little differently. It puts energy in the skin. Now, technically, that energy is generated by the body, the tissue's resistance to that radio frequency energy, and makes heat. So we translate our radio frequency energy into heat.
Right.
And some of them don't generate that much heat, so you can do them without any numbing. We have some delivered via micro needles that go down in the skin, radio frequency micro needling, a favorite. So I'm able to put heat in different layers of the skin. Some are so intense, it's a little tiny needle, and I can use that on specific areas like fat pads under the eyes, and that requires numbing for that. So another difference between lasers and energy-based devices has to do with our goal of treatment.
Yeah.
Sometimes we're looking for that heat just to tighten skin, and sometimes we're looking just to lighten brown spots. So our goal of treatment may have something to do. The good news is we often put them all together.
We do.
In the same treatment so that we can tailor it just to what you're looking for. We can remove sun damage on the surface by helping redness and brown, and we can improve below the surface by putting energy down deeper.
Yes. Very often patients in the consultation will say, well, I just wanted to treat this brown spot, but what Dr. Rostan sees is sun damage. And so talk a little bit about how you personalize those plans for patients that are really coming in for 1 or 2 brown spots, but want that overall improvement.
Yeah, so based on what we've been talking about wavelengths, you think, well, gosh, that'd be so easy to remove brown spots, right? But it's actually very tricky because the brown spot is adjacent to normal skin. And what we rely on is actually a contrast between your skin color and the brown spot color. So if you have really white skin, very, very light, and the world's darkest brown spot, bingo, you are the winner. we can treat that one brown spot. But often what happens is there's one brown spot that really gets on your nerves. You just know, I don't want to deal with all this. It's this one right here. Mm-hmm. But the background is a lot of sun damage,
right,
and a lot of other brown spots, giving that skin a brown tone. So my laser is not magic. It can't pick up that difference. So we need to target that by doing a field treatment, treating the whole area. And so it'll make your skin healthier anyway, which I love. And I think you'll get a better outcome. But the reality is, I am putting you at risk if I just try very aggressively to get one brown spot without targeting the whole area. So lasers aren't magic. I wish they were, but how do you prepare our patients for telling them about how non-magical lasers are in terms of downtime and prepping for that? And number of treatments.
Yeah. So a lot of times patients come in and they'll say, well, okay, I know I just wanted this one brown spot, but Dr. Rostan's personalized this plan for you and there's multiple treatments. Oh, okay. They'll say, not just one?
Not just one.
And,
whole series.
We recommend an entire series of treatments. We want optimal results for our patients. And I know that's their goal too. They want to look better without makeup.
Yeah, and I love that look. Looks polished.
It does.
Looks very pretty. And what I like about it too is it actually creates healthier skin. And we know this. It is a treatment. Some of these are a treatment for precancerous spots on the skin called actinic keratoses or actinic damage. And but we've learned that the renewal process with the laser actually makes the skin healthier. So we thought it was just by working on the surface. You see the change in the surface, right? It makes sense. My sun damage looks better. It's gone. But actually, magically, oops, I just used the word magic. But
okay,
it does
your wand came out.
I know. It does feel magic, though. The renewal process taking place under the skin renews a cell called a fibroblast. And it turns out that fibroblast not only makes collagen and elastin and extracellular matrix for your skin, it acts as a signaler to the upper layer of skin to tell the upper layer of skin, hey guys, there's a bad cell next door. Get rid of it, okay? So as you get older, these fibroblasts, they're just laying around. They're in retirement. They're called senescent. We need to do a whole podcast on senescent cells. But they are just laying around in your skin. They don't go away, and they can actually do bad things, but they're just sitting there, not doing anything. Yeah. The laser wakes them up from retirement. Okay, and they start making collagen and elastin and extracellular matrix, and this is how you get these nice results from the laser. But this is where the healthy comes in.
Right.
Turns out, once you wake these cells up, you renew the signaling mechanism that polices your upper layer of skin and fights off skin cancers. So skin cancers become more common as you get older because of cumulative DNA damage, cumulative sun damage, but also loss of this signaling mechanism. So if you do a series of 5, say, fractional treatments, it's amazing. It really is. But we've been doing this for a long time, this combination approach. And I wrote a paper about it at this point, probably 15 years ago, combining a lot of lasers, not a lot, 2 or 3,
right,
in one session, the same session. And so my patients get their results more quickly. Your skin looks better, it looks fresher, smoother, polished, brown spots are better, redness is better, texture looks better, and it's great. And the main reason I did that is it was easier for patients to come in for, say, 3 treatments.
Right.
Back in the old days, when the fractional laser first came out in 2003, every patient got 5 or 6 treatments, and they got incredible results. So if patients ask me, and you, right?
Right.
How many treatments do I need? What do you tell them?
I say the goal is 3. If you can commit to 3, you will have great results. Now, this also includes skincare, right, Dr. Rostan?
Absolutely. You do need to pair skincare with it, and we'll definitely talk about that in upcoming podcasts because it goes hand in hand. I have a colleague who has said 80% of how good your skin looks is procedures. So come in and get these laser procedures we're talking about, but 20% is good skincare.
Right.
And when you put the 2 together, you get 100%. So that's definitely critical. So I've talked a little bit about the mechanism of this and how it occurs over a series of treatments. But, what are we doing with these lasers? What's going on below the surface? So it's a renewal process. So some of it's a targeted process. We have a blood vessel. We can have a laser that targets technically oxyhemoglobin, which is in the blood, and shrinks that vessel with heat. We have a brown spot. We've got a laser that can target melanin. We hit it with the laser. It lightens. Same thing for laser hair removal. The target is pigment. That's why I tell people if you have little white baby fuzz, it's not going to work on that. But if you've got dark hair and light skin, it works great. And then when we talk about rejuvenation, the laser penetrates down deep. The target is actually water in your skin. But all these lasers, when they hit their target, it initiates a healing process. The heat goes in there, a cascade of event occurs, almost as if you cut yourself, your skin heals. Mm-hmm. But these are well-controlled, microscopic wounds telling your skin, hello, wake up, let's make some collagen, let's renew. It's a renewing process. And so, again, that's why we want to pair it with good skincare products that help your skin respond to that process. So the process of laser, light, and energy-based devices, rejuvenating skin, helping acne scars, is a renewal process. It's us stimulating your skin via a laser to go through a healing process, and that's what it's all about. When we do an ablative laser, there's a little bit of vaporization of bad tissue as well, and sometimes we need that in more damaged skin. But all of this is creating little microscopic wounds so that you heal. It's a healing and renewal process. So I know, and you know as well, one treatment's not enough.
No.
And particularly if someone hasn't maintained, and thankfully I think there's a new trend now to stay on top of it, to maintain. Prejuvenation has been called.
Right.
Getting it done before there's deep damage. But we sure treat a lot of people that have a lot of sun damage and
Have never done anything.
not done anything.
Yeah.
And so how do you counsel them about the process? I know you tell them you're going to need at least 3 treatments.
Yes.
And how do you tell them about follow-up?
So I like to talk them through what their journey will look like here at the practice, because I think when you come here, you're a patient for life, right? We get to go through all of the different chapters of life with you, whether you're a bride or a soon-to-be bride getting married, we take you through that journey. So when you come in for the consultation and we're talking about your laser treatment plan, I like to say we get to see you for 3 months. We see you for 3 months in a row for your lasers. After that, there may be other steps recommended in your treatment plan, but we're taking our tools here, as Dr. Rostan likes to call it, pairing them together to give you those optimal results. From there, patients will say, well, I've never had a laser. Is this going to hurt? We like to say, we use topical numbing for laser treatments here at the practice that are not low-level lasers, or as Dr. Rostan, how do you like to describe that to patients?
Well, lasers hurt, but it's heat, it's energy into the skin. But we have a lot of lasers and devices, laser light and energy devices that don't require any topical numbing. Many of them don't have any downtime, so you can prep your skin right before a party to look great.
Right.
0 downtime. I don't think anyone believes me, but this laser is that short pulse laser. I call it a laser facial, laser toning, laser facial, and it does that renewal process. It wakes up the skin, and that's what we're doing. I do the fractional 1927 laser.
Yep.
At a low level without numbing. I don't think it hurts that bad.
She also has a very high pain tolerance. Let's just be honest.
But if you did a higher level with the topical numbing, I don't think it's that bad. IPL has got a little jumpy feel to it, but we do things. We take patient comfort very seriously.
We do.
And so we try to make you comfortable from the get-go. We try to inquire ahead of time about your tolerance for discomfort. And if it's really poor, we advise that we help you. We can give you something to help you relax. Sometimes it's not even the pain. It's just the concern, the anxiety, the fear. Don't let it take over. Let us help you with that. Bring a friend. Friends are great buddies. Even if we don't give you anything, you've got a hand holder, someone you trust. And what we find is as we go along, patients trust us more and they lose some of that fear and anxiety.
Right.
But we can give you things to help with the pain. And when we get on into the lasers that are ablative, fractional ablative, they're more painful. We can definitely give you something to help with the pain, and you do need a driver for that. But I like to hit it head on in the consultation. How are you with procedures? How do you feel? How do you feel about getting this done? Are you real anxious? And some people say, well, I don't know, it kind of freaks me out, but I'll be fine. And I'm just like, no. Let's not play the I'll be fine game, because the stress about it is real.
It's very real.
It's like, let's just be real about this. Bring a buddy. We'll give you something to help you relax. Here's how the day's gone. We're going to role play it before you leave, so you'll know what's going to happen. And then generally what happens is people generate more trust, and they feel better about the process, and they go, oh, it wasn't so bad. Well, okay, good. But I just hate the idea of someone feeling very anxious about it.
Right.
We can make it very approachable to them.
Yes.
Here's one that comes up a lot in the consultation. How long do the results last?
Oh, yes. That's a great one.
Oh, yeah. And so I say brown spots have a memory. They are a reflection of sun damage. Will the brown spots come back? Yes, they will. And not necessarily right back to the way they are now, but they do slowly come back. I'm going to recommend an anti-aging skincare plan for you. We're going to add these products to help prevent brown spots. In terms of fine lines and wrinkles, what we're doing is building new collagen, new elastin, new cellular material. But as time goes on, you're losing those.
Right.
So here's how I describe it. And anyone who grew up in the 70s, 60s, 70s, or 80s might have watched The Days of Our Lives with their grandmother. And it was the hourglass. Okay?
Yeah.
So the top of the hourglass is your collagen and your elastin in your skin. And then it's just with time, it's going through the little hole and you're losing it. All right? When you do device treatments, laser, light, or energy-based devices, you're putting more sand in the top. Good for you.
Yeah.
You're building it back up because your skin will not do it without stimulation. When you use good skincare products, maybe combine your laser with biostimulatory filler, PRP, good skincare, you're narrowing the exit hole, okay? So the plan is pretty simple. Let's add collagen to the top, and then when I send you home via lifestyle changes, via other office procedures we do here, via good skincare, let's narrow the loss of that sand up top so you can keep it longer. But yeah, a lot of people are like, well, that's a lot of money and it's just going to disappear. It doesn't just disappear, but time does march on. Is
Right.
that how you?
Yes.
She hears me tell this to patients, but then after I leave the room, she probably has to explain it further.
We spend a lot of time talking about this one-on-one, me and the patient, and I think they get overwhelmed at times when they have young children and, mom's on the go, or maybe they're at the time in life where they're traveling a lot. And so how do they maintain these treatments? And I always strive to set them up for success. Like, if we know that you have 2 trips back to back, let's not start until you come back. And then we can go on with your treatment series versus they'll come in for one treatment, go on those 2 trips, and then life gets in the way. So we also always have that conversation.
Yeah, and I've been trying to emphasize to our patients, I just can't find the time to come in. I can't have that downtime. We do have laser treatments that really have zero downtime that you can do in between, or if you've missed the starting clock on before the holidays, you can come in and get a laser facial, laser toning without downtime. But these things do need to be maintained. I would recommend a series of laser treatments every 9 to 12 months. Mm-hmm. But sometimes you got to do more just to catch up. If we're playing catch up, it's a different game.
It's different.
And if you are coming in at age 45, 55, 65, having never done anything and had a lot of sun damage, the 3 treatments that Alexxa is going to recommend to you, it's not going to give you the same 3 treatments that it's going to give Alexxa. You might need some catching up to do. So it might be do 3 every quarter and really catch up. So
and believe me, you'll become obsessed with the way your skin looks after.
Well, that's true.
I think that's the other part about lasers. Even for myself, I have melasma, and I have to maintain that with skincare. Mm-hmm. And I want to, because my skin, it's the first thing that we see on people. We want really healthy, great-looking skin. And when I notice there's a dullness, I'll say, okay, I've got to really amp up my skincare now. I'm going out.
We've talked a lot about kind of rejuvenation and a little bit about brown spots and redness. Lasers can also be used to treat a lot of other things, rosacea, sometimes acne. We can use it to get rid of unwanted hair. We can use it to stimulate hair. We can use it to treat precancers, birthmarks, a variety of things, but also scarring. And early scars are well treated with a laser. Burn scars, traumatic scars, surgical scars, and acne scars. And the same principles apply. which is we are helping a renewal process. So everything we've talked about for rejuvenation applies to scars. So in the acne scar, the inflammation causes deep structural injury to the skin, and you get marks both on the surface as well as underneath. And we need to help renew structure. So our lasers and our devices help us stimulate renewal of structure that is gone because of scarring, not gone because of age and sun damage.
Right.
We'll definitely do more podcasts on scarring because there's so much to get into, and it's so fun and life-changing. Speaking of life-changing, share with us some of the stories that you've heard about our consultations that have done a series of laser treatments and how they're liking their results and how it was to go through it.
Yes. Actually, just recently, I had a patient call. She had never done anything before. And she was in her 50s, I would say. And it was a Friday. She called and said, "Hey, Alexxa, I just wanted to call and share with you that I am loving the way my skin looks, but I had the biggest compliment yesterday." And I get really excited because I do really connect with our patients, and it's fun to see them coming in. And she said, my husband was sitting across the dinner table from me and looked at me and said, "Honey, I don't know what you've done, but you just look really beautiful." And she said that was the best compliment she's had in so long. And she talked to me a little bit about how she remembered coming in for her first treatment and feeling really scared and anxious. And the downtime really wasn't that bad. And she said, my friends, they get lasers and they're scared to go out, but now I have no fear. I will go to lunch with my girlfriends after a laser treatment because I'm excited to share what I've done for my skin.
Well, I definitely go out after a laser treatment. But it can be different. You can have a little bit of sometimes more downtime. How do you talk to patients about downtime?
Depending on what laser treatment Dr. Rostan has recommended for you, it's very similar to feeling like a sunburn. And hopefully you haven't been sunburned this badly before, but we are in the South. So you're red and swollen. You look like you have a sunburn.
That's typically just the first day, 24 hours.
Yes. Sometimes 48, depending on the device. From there, your skin's just going to feel like sandpaper.
That's what I say. You can feel the laser impacts.
Totally.
And it does get a little annoying. You're like, gosh, I want this off. And you can kind of rub it off after about 5 or 7 days. No one notices unless you're really looking close.
So, and using a magnifying mirror.
Yeah, you really get in there, and then you can feel them. The exception is individuals that have a lot of brown.
Right.
So every brown spot will kind of change color, and it'll darken for a short period of time until it lifts off.
Right.
You can put makeup on to cover it. I just say it kind of looks like you got the wrong tone makeup on.
It does. Yeah.
But that can be very distressing to some patients. It's social downtime, not real downtime, with the exception of the fractional ablative lasers. The main one we're using right now is ultra clear, and we can do a podcast on that. But that's very customizable. But if we really nail down and say we're going to do an aggressive treatment, the way I say is we'll be friends again on day 3 after the laser. Day 1 and 2, you're going to think, I can't believe I trusted that woman. She had great reviews, and my friend loves her. I don't know what I just did. Day 3, you're going to know why we did all that, and you're going to feel better. So you have to be prepared for like 4 days of downtime. And even day 5, I don't think you're looking your best, but we try to prepare you for that. And we look at before and after photos of some patients like day 1, day 2, and just to prepare you for that. And of course, once you do one, you'll understand it and know. But we try to walk you through that process so you're prepared.
Yeah. We actually use a great program in the consultation as well to help patients understand what to expect.
Yeah, it shows them pictures at their fingertips on your phone.
Yes.
Harnessing technology to try to help educate and prepare our patients for their journey, prepare prepare them for success.
Exactly.
And feeling good about it.
We have patients that come in a lot and ask, or say, I want to look good for the holidays. When should I get started on these laser treatments?
Probably yesterday, but the time is now. It's the weather is cooler. It's great. Yeah. The sun is not so direct anymore. We're not out at the pool anymore, the lake. Our outdoor activities are limited. So now is the time, and you get started now. You'll start seeing your results around holiday time and definitely into the new year. So I say roll up your sleeves. Now's the time to come in for a consult with Alexxa or one of our laser staff downstairs, and we can craft a plan for you. Or maybe you already have a plan. We put one in your back pocket a little while ago. Fish that thing out. Look on your phone where we sent you via TouchMD your plan, and now's the time. So we look forward to seeing you. We'll probably start sending out some reminder emails about now is the time, because we get excited when you're excited about looking good for the holidays.
Totally.
I think that about sums up Lasers 101. You can see that we can go into multiple podcasts about all these things we love talking about. Yep. But we've talked about lasers, light, the IPL, energy-based devices, radio frequency. We missed thermomechanical, Tixel. That's a fun one. We've talked about some of the things that make lasers seem so hard to understand, wavelength, cooling, and pulse duration. But once you get with the lingo, you'll be like, no, I need a short pulse duration for that. I swear, patients do that. And we've talked a little bit about clearly the parts we enjoy about the lasers and delivering nice care and great results to patients, both for just looking great and prevention, for reversal of sun damage, and gosh, the treatment of scars is life-changing for patients. So it's been my career. Clearly, I love to talk about it, and I appreciate you tuning in today to learn about lasers. We look forward to sharing with you more in the future.
Thanks for listening to Queen City Skin with Dr. Elizabeth Rostan and Dr. Emily McLean.
We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too.
If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom.
And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser.
Here's to healthy skin and feeling your best. We'll see you next time.